Hi guys, welcome back to my channel. So I am heading right now in a little bit to go see my surgeon, Dr. Beck, for my 12-week checkup post-op from my surgery 1 on my legs. So I haven't updated you guys in a while on how I'm healing, what's going on. So I thought it'd be kind of fun to bring you guys along with me to my appointment and kind of fill you in as to how everything's healing, how I'm doing, and what surgeries and all of that we have next. So let's go. So I'm here in the office and waiting for Dr. Beck to come in. This is kind of the typical room, my chair. This is the chair that they usually have to pull me all the way back when my legs are like all the way in the air because I usually pass out. But I'm gonna put my gown on and I'll see you soon.
Okay, so I'm here with Jacqueline, and we're 3 months out from doing a large procedure, liposuction, to her legs and her thighs. And we're looking to potentially talk about the next procedure. Yet on exam, Jacqueline appears to me like she's holding on to a lot of fluid. Like, it doesn't look like she's gaining weight, it looks like she has really retained a lot of fluid. And so I'm suggesting to Jacqueline that she goes to her primary care doctor and get a basic set of labs to assess her kidney function, her liver function, cardiac, thyroid, do a full workup just to make sure that she's doing okay from a medical standpoint. After that, I'm also going to refer her to a person who's very dear to me, who thinks outside the box. His name's Daniel Dunphy, and he is great with regards to detox and looking at what type of things we can do to eliminate any potential toxins that are inside, which may potentially be a reason why she's holding on to fluid. And so we're going to work on getting basic labs. We're going to look at potentially some type of a detox program from somebody who's an expert in that. And then also trying to do things with regards to working out more and trying to burn fat, which potentially holds on to toxins, and that will be, and so that's been only a couple weeks now, right? Mm-hmm. So it's only been a couple weeks since she's been able to really get back into the gym. So we're starting to do that too, but I think that this is more than just the lack of exercise. I think this is potentially some type of harvesting different toxins that she needs to try to get out of her system. So that's where we are today.
And legs are healing great.
Legs are healing great.
Yeah,
legs
they
look
really good.
They're doing well.
Yeah, thank you.
Yeah.
I'm home from my appointment with Dr. Beck. I know he filled you guys in a little bit about what's going on and how I'm healing, but I just wanted to come on here and kind of share with you what I'm feeling and how everything's healing, like on my end. So as far as the legs go, the legs are healing great. They look so good. The pain I was having from before with all of the weight has drastically gone down. It doesn't nearly hurt as bad as it was. And I'm able to kind of, with more of my workouts, start toning and strengthening like my butt, my legs, my groin, and kind of start strengthening that without all of the weight on that. And the little incisions, everything just looks perfect, and they're healing really great. So again, another surgery that I'm so happy that I had, and the recovery and all of that sucked, but it's 100,000% worth it so far, and I can't wait to have the second part of the legs done, and I know I'm just going to feel so much better after the rest of the weight and all of the skin is removed on the legs. So as far as what's next and kind of how I'm continuing to heal, I am holding on to a lot of fluid, like Dr. Beck mentioned, and my whole body is puffy, for a lack of a better word. And I've really been noticing it, especially like in my arms, my back, my face, pretty much everywhere where I haven't had skin removal surgery. So we're not sure if from like the procedures, if the liquid's kind of settling in those spots where I still had loose skin. But it's really weird because when I touch the areas that are like puffy, you can feel kind of the fluid moving. So I know it's fluid, but there's just so much of it. So, hearing Dr. Beck kind of say, I'm really holding on to water or the fluid or whatever it kind of is, which is making me look really swollen and puffy. And I know a lot of you guys are mentioning it to me or commenting or, asking if I'm gaining weight, what's going on with my body, why did I look so much smaller before? And, going through these procedures, it takes a lot out of you and it takes a toll on your body, and as positive as they are and how much, they've helped me tremendously, it's still a lot on your body. And my body, I feel like right now is just kind of freaking out and not really knowing what's going on. And the amount of weight of the skin and like the fluid that he took out, all of that stuff, I feel like my body's really just trying to readjust and figure out what's going on. So I am still really swollen. It is really bothering me. It doesn't really hurt, but it's just uncomfortable. Like you just feel like swollen everywhere, and it's uncomfortable. And mentally, it plays on you a little bit and makes it kind of hard because my clothes aren't quite fitting right or the same. And like I said, you guys are mentioning it. My surgeon noticed it. I'm noticing it. So there's just a lot where it looks like, I've gained a lot of weight, especially like right before surgery to now. So that's kind of hard. So I am going to go see my doctor, go get some lab work done, and kind of just figure out what's going on. So there's no other surgeries planned. We have nothing in the works. There's still about 2 more that I have to have done. But until we figure out what's going on with my body and get like these fluids out, we're not focusing on another surgery. We're just going to focus on my health right now, working out more, trying to sweat more to get it out, having massages, seeing my doctor, doing blood work, maybe going to see a specialist, and figuring out what's going on. So it's hard. I'm still struggling with it, but I think moving more, working out more, it's all just going to help, and hopefully things depuff very soon. So that's kind of where we are right now. The legs, like I said, they're not really painful anymore. So yeah, everything is healing great. We just have to get rid of this fluid. So thank you so much for all of your continued love and support, especially all of you who've been with me through the surgeries, with all the surgeries, and all of you maybe who are new to my journey and have, left me kind words, messages, comments of support, motivation. It truly means a lot to me. This journey is difficult, but with people who support you and help raise you up, it definitely helps. So thank you so much for watching this video. Please give it a thumbs up. Make sure you're subscribed if you're not already, and I'll do more check-ins and updates and let you know how I'm continuing to heal more in the future. So thank you so much, and I'll talk to you guys all soon. Bye.